Good afternoon, everybody. We're going to give people a few minutes to log in, and we'll get started right away for you. Thanks. All right, that should be good. Hello, everybody. Again, I'm George Bundy, the manager for field development for Autism Speaks in Michigan. And I wanted to personally thank everybody for joining us today. Our team is going to update you on the important advocacy initiatives that we are championing, both locally and nationally. Autism Speaks is dedicated to promoting solutions across the entire spectrum and throughout the lifespan for the individuals with autism and especially their families. We do this through advocacy and support by increasing understanding and acceptance of people with autism and advancing research into the causes and better interventions for ASD and the related conditions. Through these partnerships in collaboration with individuals just like yourselves, we are committed to promoting a kinder, more inclusive world for the autism community. We will be hosting a reimagined walk this year in order to, first and foremost, be safe and consider everybody's health. We will be doing a virtual event on September 26th. My contact information is there. You can also follow us on Autism Speaks Michigan Facebook page, where we'll be having updates all the time there. So please join us and celebrate the day in a safe and healthy way, any way that you can. And with that being said, I'd like to introduce our team. First, we're going to have Judith Aresti, who is the Director of State and Government Affairs for Autism Speaks, and she's going to start us out.
Thank you, George. And thank you, Michigan friends, for joining us today. It is super exciting to be with you. Michigan has a vibrant autism community, and we've been involved there for many years at Autism Speaks, working with all of you on insurance reform and other issues. And we're so excited to connect today just to talk about what's going on federally that affects you on the ground in Michigan, and then also talk about some state-specific things that we want you to be aware of. And we're doing this really in response to outreach from our community, from self-advocates, from parents, from siblings, from providers who are reaching out to people like George and our field staff, our autism response team, our advocacy team. And this has been such a challenging time for a community that already really deals with so many challenges to begin with. So the newer challenges that we've heard about from all of you that really is informing our advocacy is just, school being closed and school being disrupted, closure of day programs and opportunities there for adults with autism who are looking for services and for continuity. Healthcare, the clinics, that children might go to for ABA, or even just well visits you might have with your doctor, medication management, all those things are disrupted. And they've shifted to telehealth, and we've heard some super exciting good things about telehealth and how it's easier in many ways, and it's opened the doors to access for many people. But then there also is just the challenge of some folks in our community, because of their profile, because of some of the challenges they might face, it's really hard to participate in telehealth. So mixed bag there. The increased need for mental health supports for people on the spectrum, for their families. I will say, I started talking with a counselor towards the beginning of the pandemic. Hadn't done that in a really long time. And just having access and needing access to that support as a mom has helped me. And I'm hearing that a lot from other folks too. And there's absolutely no shame or stigma in that. It's super important, and I encourage you to seek it out if you need to. There's a lack of connection to community opportunities and supports. And forgive me, for being a little obnoxious, but all these pictures on the slide are of my son, Jack, who was diagnosed with autism spectrum disorder at the age of 2. And he is now almost 17. He'll be 17 in just a few weeks. And every week on Saturday for many, many years, you can see these photos kind of are like a timeline of Jack's life. On Saturday afternoon, he starts asking for wings on his iPad. What he means is he wants to go to a certain place to get wings, and that is the Outback Steakhouse. And it's not just about Outback or the wings, it's about the staff and the way they smile when Jack opens the door and walks in, and the way they talk directly to him as a person, which is wonderful. Jack is accepted and is an important customer to them. This is not an endorsement of Outback by any means, but I will say our particular Outback, the staff, they're friends to Jack. And so when that was disrupted, when he couldn't request that he could request it on Saturdays, but when we had to try to explain to him that that's not an opportunity right now, it's really devastating for him. And so for many of you, I know there's been similar things, whether it's going to a movie or looking at trains or, just basic things that might be, trivial to others are so important to our community. Moving on, people who have autism who've worked really hard for employment opportunities, and they have so much to give, and now those are disrupted, those opportunities. Respite for families is so important, and that has been disrupted right now, as are just the regular routines we've talked about, like school, church, leisure activities, whatever they might be. A huge issue is loss of employment, loss of income, having to try to pay our mortgages, our rent, our utilities, and then thinking about the other costs that are specific to autism, therapy, services that are needed. It's so hard. Challenging behaviors are not uncommon. In fact, there's something our community experiences frequently, and we want to speak about it respectfully and, of course, think about people's privacy while also acknowledging the reality of this issue. It affects the person with autism so much. It could be self-injurious, they could be aggressing towards others because of just different things going on, where they cannot control their presence, and they're just, the behaviors are challenging to them and to the people around them. And that can lead to really devastating consequences. So that happens even more so when people are not able to follow their regular routines, when they're isolated, and they're not able to access the services they might usually. We're hearing a lot from families about concern around access to healthcare with appropriate supports, and that's the important part there. What does that mean? It means, for example, if you have a loved one who is on the autism spectrum and perhaps they are diagnosed with COVID and they have to be hospitalized, what does that look like for them? Are they able to have caregivers or people with them, to help them advocate for what they need when they're hospitalized? Just an example, and that's been a challenge right now. And then, of course, definitely this week, I know, and in the weeks prior, there's been so much back and forth just about education in general in Michigan and what that is going to look like. It's a big tug of war, and it feels like not even mentioned are the special education students, the students with autism, and what they need, what they deserve, what they're entitled to. So forgive me for that long explanation, but I did want to acknowledge to all of you that we're hearing these messages, and we certainly want to, through advocacy and community supports, do what we can to help in this really challenging time. So we're going to talk about some of the advocacy activities today, and we're going to provide you a ton of information Hopefully it won't be too overwhelming about what's going on in Washington, D.C., about what's going on the state level. Right now, your mics are muted and your cameras are not on, just so that we can maintain our bandwidth and be able to share this information with you. What you can do, though, is type away in the chat box. So Kelly Hedrick, who runs our state advocacy team, as well as our grassroots efforts nationwide, she's monitoring the chat box, as is Allie Smith, who does our grassroots. So they're there to engage with you. If you have any comments or questions, we want to hear from you. If you have challenges that we might have missed that aren't on this very long list, we want to know about them so that we can do our part in working towards solutions. So please do share, and we will, from time to time, stop talking at you and give you an opportunity to ask questions. So stay tuned for that. Talking about all those challenges and concerns, throughout the presentation, I do want to mention and remind you that Autism Speaks does have an autism response team that is there for you. You can email them at help@autismspeaks.org. You can call them. They have a number that's manned by a Spanish-speaking person, and they have access to resources that they can share. So please do share this information with people who might need it, and you yourself, please use it too. If you have a question today that we cannot answer for some reason, please reach out to the Autism Response Team. They're amazing. All right, so that's enough for me, other than to say thank you, George, for introducing us. I encourage everyone to participate in the walk. Now more than ever, we need your support so we can continue to do research, provide advocacy, promote awareness around the globe. So today, you talked with George. Dave Sikoski is going to do our federal update. I got your last name right, Dave. I've been practicing. And then I'm going to talk a little bit, I promise I will not go on and on really, about what's going on the state level. And then Colleen Shin does community outreach for us in Michigan for Autism Speaks, and she's going to talk about resources we want to make sure that you're aware of. So Dave, I'm going to turn it over to you now. Thank you so much for being here today.
Thank you, Judith. Great to be with you all today. So as Judith mentioned, my name is Dave Sikoski. I work on our federal advocacy team out of the Washington, D.C. office. And in that role, we engage with members of Congress and the administration, et cetera, on our autism-related priorities. So what I wanted to do is bring you through a high-level overview of what's happened in DC since the onset of the pandemic in the United States, and talk about where things stand as of right now, and then get into some of the specific priorities that Autism Speaks has been advocating on. And as Judith mentioned, please don't hesitate to put in questions into the Q&A box. Be happy to try to answer them. And then, even after, if you think of something, don't hesitate to reach out. We'd be happy to follow up. So, beginning in early March, Congress started working on and passing bills to try to address the COVID crisis. Back on March 6th, the first bill, the Coronavirus Preparedness and Response, I always get tongue-tied with this one, Coronavirus Preparedness and Response Supplemental Appropriations Bill passed. It's a long way of saying additional federal money to help with the public health response to COVID, to provide out to medical providers and health, the health response throughout the country. This was really the first opening salvo in the government's response, at least from Congress, on this. And I should note too, we've labeled these COVID 1, 2, 3, 3.5 at the bottom there. And that's just the chronological order in which these laws have passed. Sometimes you'll see that in articles written about Congress and COVID. So just wanted to point out why they're labeled as such. March 18th, the Family's First Coronavirus Response Act was signed into law. This really was aimed at at least starting to provide some relief to individuals and families. So the item of particular note is that it did provide for emergency paid sick and family leave for individuals at employers that have less than 500 employees. And this allowed eligibility not only in addition to the current categories, but allowed for eligibility for people who are dealing with COVID-related illness or family members dealing with COVID-related illness, as well as for the parents of kids whose school is not open or a daycare wasn't open. One of the things that I'll touch on a little bit, I guess, later, but wanted to note here is that the law didn't make it clear whether or not parents of adults with disabilities whose regular day program or source of care was no longer available would be eligible for this. Fortunately, that was clarified and they are allowed. But in addition to the paid sick and family leave, there was a myriad of other things, more money for Medicaid, some food assistance policy, some testing funding that was provided, and insurance-related provisions. But those were the main things that that were captured in that specific law. Moving ahead to March 27th, the Coronavirus Aid, Relief, and Economic Security Act, or CARES, was signed into law. This is the law that I'm sure all of you have heard about in one way or another. This was a $2 trillion relief package. This was the major bill that has passed in Congress to address a whole host of different issues, whether it's funding for state and local governments, funding for the healthcare response, and then the things that really impact families, some other things that impact families directly, like the economic impact payments. These are the $1,200 payments for most individuals throughout the country, $500 for dependents under the age of 17. This is the law that provided the temporary increased unemployment benefits, so the $600 a week on top of existing benefits, which did expire at the end of last month. Assistance for small businesses to provide forgivable loans to keep people on payroll, billions of dollars for schools, which Judith will talk about later on, and an extension of the Money Follows the Person program. So this was really the biggest action that was taken by Congress since the outset of COVID-19, and even from that point, there was discussion that there would have to be an additional large relief package done at some point in the future. That's where a lot of the conversation has been since March 27th. I do want to note, on April 24th, there was another bill that passed and became law called the Paycheck Protection Program and Healthcare Enhancement Act. And the reason it's labeled COVID 3.5 is it doesn't reflect that larger desire from some to have a big trillions of dollar relief package. This was an agreement to replenish the Paycheck Protection Program. That was the forgivable loan program for small businesses. And that had been given $350 billion in the CARES law, which ran out in about 2 weeks because of the really huge need. And so that COVID 3.5 bill just replenished that program, provided several hundred billions of dollars more, and then also provided some additional money for the public health response and for testing. We can go to the next slide, please. So what's next? If you've been following this in the news, there hasn't been a lot of movement to this point in terms of Congress and the White House reaching an agreement on what the next relief package will look like. Back in May, the House of Representatives passed the HEROES Act. This was a $3 trillion relief package that covers a whole host of things. So you've probably heard a lot about the postal service recently. This bill contained money for that, contained a variety of housing provisions, provides $1 trillion for state and local governments, et cetera. It really a wide swath of different issues were covered within this law, or bill, excuse me. I do want to point out that at the time that this passed in the House, the Senate Majority Leader McConnell said that the Senate would not be taking up this bill. So really, this was kind of the statement from the House of Representatives on their priorities for the negotiations that would be coming up. But it's not something that is going to be passed in the Senate and become law. In this specific form. We do want to point out a few priorities that were included within the HEROES Act that we're hopeful will see their way through and will continue to advocate on as these negotiations continue. So for example, there's a substantial increase in funding for home and community-based services. There was $100 billion for education. It fixed the issue related to dependents over 17 not being eligible for economic impact payments. I'll touch on that in a second, and then provided that they would be eligible for a new round of payments. On July 27th, the Senate released a $1 trillion relief package proposal. It included additional stimulus type payments. It ensured that dependents of any age would be eligible for the $500 economic impact payments, provided $100 billion for education. But similarly, the House said that they would not be taking up this bill as it stood. So right now, we are in a bit of a stalemate. There have been some conversations between the Speaker of the House and the White House and the Senate as of the recent weeks, but no progress has been made, and both chambers are on recess until September 8th. So I do think with the conventions being last week and this week, that it's not likely until sometime close to when they get back in session that there will be a real uptick in negotiations and the possibility of any type of agreement. But everything is kind of to be determined at this point. Can you go to the next slide, please? So despite the fact that there is this stalemate, there is still opportunity to weigh in with members of Congress and to advocate for the priorities that we've been hearing from the community are important as they work to reach some type of agreement. So I mentioned home and community-based services. This is a big priority in terms of our advocacy to try to increase the amount of funding so more people are able to access home and community-based services. That funding allows for the payment for personal protective equipment for those who are performing that work and for individuals receiving the home and community-based services, to ensure that there's like hazard pay and additional pay that's available to ensure there's a continuity in workforce. So just a variety of different things that this money can be spent on, but we know there's a huge need, and we've been pushing hard along with many other advocacy organizations as well to try to see a boost in any future bill. Additional funding to meet the educational needs of students with autism. I know Judith already talked about this and the challenges for students in our community. What we've been advocating at the federal level is to just ensure that school districts have the resources they need for whatever situation that they're in, whether they're in person right now or virtual, that students are able to receive technology and or that the resources are available to make up for the learning loss that we know has occurred over the course of this time since March. And so this is going to be an ongoing priority and something that we're going to continue to fight for. And there is some good there are some good bills in Congress on this right now, and we're continuing to push on this. Protecting the rights of students under the Individuals with Disabilities Education Act, IDEA, and other laws has also been an important priority. I think at the federal level, at least, the federal level, we haven't really seen any additional threats to this since March or April, and in March there was some concern that that Congress might waive some of the really hard-fought rights that have been won over the many years for IDEA. We pushed back against that. Many other advocacy groups as well pushed back against this, and unfortunately, Congress hasn't done that. The Secretary of Education actually put out a report in April that Congress had asked for, that said that there was no need for any waivers of the core protections of IDEA. So while we'll stay vigilant, of course, on that, at the moment, there isn't any apparent threat in Congress for any rollback of protections. Expanded access to telehealth services for healthcare needs. I know, again, Judith had touched on this. I think what we're trying to advocate for is for those telehealth services that are working, in understanding that it doesn't work for everyone, and not every service is going to be the best under a telehealth type system. But for those services that are working, we want those to continue and want those to be provided for, not just now, but into the future, if they are beneficial for individuals in our community. So we've been advocating both within Congress and with the Department of Health and Human Services on that. Eligibility for the $500 economic impact payments for dependents over age 17. So as I touched on with the CARES law that passed in March, it left out any dependents over the age of 17 from being eligible for the $500 payments. And so we have joined with many others in advocating for a reversal of this in any future bill. We would be hopeful for some type of retroactive payment, but most certainly if there are going to be additional stimulus payments, ensuring that dependents over age 17 would be eligible as well. Next, according caregivers with disabilities, the same emergency paid sick and family medical leave policies accorded caregivers of children. This is speaking to the paid sick and family leave provisions that I talked about before. The law was written in a vague way where it was unclear whether or not parents of adult dependents with disabilities would be eligible, adults, children with disabilities would be eligible, and fortunately, we did, through some advocacy, and others did advocacy on this as well. The Department of Labor clarified that they would be allowing those caregivers to be eligible. And then preventing discrimination in treatment decisions and care allocation based on disability. We looked at several areas of this. I mean, so really at the outset of the pandemic, there was, and we continue to remain concerned, but really at the outset, there was a lot of concern about, with the huge numbers of people going into hospitals with COVID symptoms, that there would be and that there was discrimination being made about who got treatment based on whether or not they had a disability. And so we applauded the Office of Civil Rights through the Department of Health and Human Services, who issued guidance to healthcare providers across the country saying that you can't do that, and really strongly weighed in on that. And so that was positive, but of course we remain vigilant on that as well. We've also put out some statements related to ensuring that group homes have personal protective equipment that's needed, as well as weighing in related to hospitals allowing individuals with disabilities to have someone with them during a hospital stay, whether it's COVID related or not. So we are constantly in touch with our champions in Congress, and then just members of Congress in general. Back in May, Congressman Chris Smith and Mike Doyle, who chair the Congressional Autism Caucus, they've sent multiple letters, but they sent a letter to congressional leadership advocating for many of the priorities we've talked about. So we're getting a push from those members. I believe on one of the letters we had a member from Michigan, I believe Congressman Andy Levin had signed on to one of those letters. And so we continue to engage with many members on both sides of the aisle to continue in both chambers to continue to push for these priorities. So anyway, I will stop there and see if there's any questions that we can answer. And thanks.
Dave, we have one question in the chat box, but it's about electronic benefits. So I don't think this one will be a federal issue since that those are done at the state level, but it's noting that very few grocery stores allow curbside pickup if you're paying with EBT. And so it's making access to these funds limited if you don't want to go into the store, and wondering if anything can be done to open up this avenue of shopping.
Yeah, no, it's a good question. I know, Judith, we've heard about this on other calls as well. And I will profess to not be an expert in this area of policy, and would be happy to follow up with you on this. I know that, through the Department of Agriculture, they are allowing some, states to basically apply to allow individuals to use use EBT for curbside pickup. But I do think there are, like, even within states, there's limitations on which stores can do it, and I don't think every state allows it. And I'll be honest, not being an expert in this area, I'm not sure whether or not Michigan has applied for this or not, or has the ability to do it. So I would love to just be able to follow up, and we can try to provide the best information we can on this. But thank you for the question.
Mm-hmm.
Thanks, Dave. That's it for now in the Q&A and chat.
All right. Thank you, Kelly, so much. And I want to mention too that Krista Stevens is also with us, who's on our state government affairs team, also helping with the chat. So feel free to share your comments and questions there. And that last question is an important one. As Dave said, we have heard that in some other states, and we can certainly check into what's going on in Michigan and see if we can remedy that situation. All right. Now we're going to talk about state advocacy. Here's your moment to stand up and stretch if you need to, eat your lunch. I'm not watching you, so it's all good, but I will try to be informative but brief. So let's talk about some of the state priorities that we're focusing on during this time of pandemic. Of course, always, for many years on the state advocacy level, we've focused on access to healthcare for people with autism, home and community-based services that are provided through Medicaid waivers usually. Those are critical right now. And then of course, everyone, or not everyone, but many of our constituents are struggling with access to special education. Perhaps you're a special education teacher and you're trying to provide services. And then of course, early intervention. So what I want to do today is just kind of share some bits of information for you. Just know too that in these slides, there can be a lot of information, many words here, and you don't have to read all of it, but there are active links, and we're going to send out this PowerPoint to everyone after the webinar today. So you'll have this file and you can click through. So if you really are a person who wants to read the details and learn more, there's an opportunity to do that. All right, so let's talk first about telehealth and what has happened. Dave talked a little bit about advocacy on the federal level. On the state level, Medicaid has told the states that they really want them to utilize telehealth and has given them a lot of really broad flexibility around that. And that is absolutely being implemented in Michigan. There's a link here that talks about what that looks like, and The governor actually did a state of emergency order and some follow-ups that clarify what that looks like. And it's available through February 28th, I think, or the end of the public health emergency. Just know that through Medicaid, telehealth is broadly available. And if you're having access issues with that, please let us know, because it should be available. And what does that look like when we talk about telehealth? Like, what do you mean? We mean access to healthcare. So things like behavioral health. There's a specific bulletin on the website that talks about access to ABA, for instance, through telehealth. And then other things like speech, OT, and PT are available, psychological, psychiatric care, even, well visits with your doctors. The sky's the limit, really, in accessing care through telehealth. We talked before about how it doesn't look exactly the same, but at least you can continue to access some level of service. On the private health insurance side, we talked about Medicaid, which is the public piece. On the private piece, most health insurance policies regulated under Michigan law are required to cover telehealth services according to your state Department of Insurance, the Department of Insurance and Financial Services. And if you click on that logo, it'll take you to the information on the Department of Information's website that provides you the details about what that looks like. But telehealth is a general requirement. And so those state regulated private health insurance plans that you're getting usually from your employer include telehealth coverage too. Okay, we're going to shift away from telehealth and talk a little bit just about access to healthcare and some flexibilities that are available there too. I want to make sure that you know about these flexibilities. Knowledge is power, right? So if you're a Medicaid recipient, whether it be for your healthcare or if it's through home and community-based services, there are flexibilities there that the federal government, CMS, that federal Medicaid agency, made available to states. And Michigan has taken advantage of those flexibilities. One of them comes in the form of a waiver called a Section 1135 waiver. And you don't have to memorize all these numbers. What you need to know is that your state applied to the federal government for these flexibilities and they were approved. And it's for access to healthcare if you're a Medicaid recipient. And so it suspends Medicaid fee-for-service prior authorization requirements. This is an example. It extends the pre-existing authorizations that were already in place pre-COVID. It modifies, simplifies provider enrollment requirements. The whole theme here is just to make the system work a little bit easier during this challenging time. And wouldn't it be nice if it just worked easier all the time? Maybe we should talk about that too. But right now, during this public health emergency, the red tape is hopefully lessened a little bit through Section 1135, and that's the healthcare piece. Also, there are flexibilities for home and community-based services. And, if you're an adult on the autism spectrum, even a child, there are waivers that are available. There are wait lists for waivers too, but for those of you who have access to waivers, and there's some examples here that could be applicable: the Michigan Choice Waiver, Habilitation Supports Waiver, the Children's Waiver Program, the waiver for children with serious emotional disturbance, and the HealthLink Community-Based Services waiver. Those are all examples of home and community-based services waivers that are available in the state of Michigan. And so some of those waivers have been amended with something called Appendix K. Actually, all of those waivers have been amended through an approved Appendix K. And I don't know how many of you had ever heard of Appendix K or have ever heard of Appendix K, but it's a remedy that is available during times of public emergency, when the president has declared a public emergency, and the states can, again, like we talked about on the healthcare piece with the 1135 waivers, with the home and community-based services piece, Appendix K makes it easier too. If you really want to geek out on the details about what the flexibilities under Appendix K look like in Michigan. I've provided the links here for the approved applications that actually went to CMS. They're super wonky, so if you like that stuff, you're gonna love reading those. But we have simplified it a little bit here, and I just created an abbreviated list of what's detailed in those approved Appendix K applications. So for these waiver services, they temporarily modify service scope or coverage. They temporarily exceed service limitations. So if your waiver only allows for a certain amount of services, visits, those can be exceeded. It expands settings where services can be provided, which makes a lot of sense because people are so limited in where they can go right now in many cases, modifies those provider qualifications, and the processes around level of care evaluations, temporarily increases payment rates so that providers can keep their heads above water, and also temporarily modifies that person-centered plan development process. That needs to continue happening, but of course right now the ability to get together and do that is hard. So there are modifications around that, again, just to make things easier. So if you're a waiver recipient and you're not seeing these modifications, definitely reach out, let us know, or reach out directly to Michigan Department of Health and Human Services and let them know, because they have been approved by CMS, and it should be making a difference in your day-to-day life. If you're a waiver recipient, there's detailed information available at the link down at the bottom of this page. Okay, and then finally I want to talk with you a minute about what in the world is going on with special education, early intervention. It's definitely something that we're hearing about from families, and it's a struggle nationwide, and particularly in a state like Michigan. It's very hard. As Dave mentioned, there's money coming down from the federal government through the CARES Act. And I've got some links at the bottom of this page where you can go through and actually see how that money went to the districts, how it was allocated. Some of it's allocated by the governor at her discretion, and then some of it's just a formula that has to be followed, so it depends. But you did receive $410.5 million for K through 12 education stabilization services. For post-secondary, $345.8 million, and then Governor Whitmire has $90 million to use at her discretion, and she has already announced how that money has been funded or utilized, and much of it is very much in line with what Autism Speaks has been advocating around for this money. And so based on those challenges we've talked about before, we've been trying to make sure that our families have access to an iPad or to Wi-Fi, the right equipment, hardware, software, communication devices. So if you can participate in virtual education, then you can have the equipment or the bandwidth to do it. Same thing with early intervention too. We're very concerned about children who are in early intervention right now and what happens to them, when they're turning 3, they're transitioning into special education. We want to make sure that they're getting all the services they need during such a critical time in their development and access to care. We're also very concerned about the loss of services. People call them different things: compensatory services, recovery services, just the services you've not gotten over the last few weeks and months when schools were closed, when they had gone virtual, when they're hybrid. Your IEP is still there, and you're still entitled to a free and appropriate public education if the schools are providing services to general education at all. So we're asking that for our community consideration be given, and for those who desperately need in-person services and who it's safe and it's feasible, we want to make sure that's a possibility. And we're hearing from so many families, some who are scared to death of in-person services, some who are desperate for them. And so we want people to have options all the way around and are advocating around that. And then finally, with regard to special education funding and our advocacy around it, we want to make sure students who are transitioning out of special education and going into adulthood, that they have the right services that they need at the time to transition out. And I know Michigan does it a little bit later than other states, but whether it's later or not, we just want to make sure that all the investment of the student, of their family, of the school systems, all that is considered and supported as they go into the adult world. So I know this is a very hard time for all of you, and I would just encourage you again to remember that you still are entitled to a free and appropriate public education. COVID did not delete that or reduce that obligation. And so when you hear blanket policies from your school system, or when people say an automatic no, we can't do this or that, just remember that I in the IEP, it stands for individual, federal laws behind you. I acknowledge the struggle right now, but I do want you to know that your rights do exist, and continue to advocate as much as you can. And if we can help in any way, we certainly want to do that. So I will step back and take a moment. Thank you all for listening today. And we certainly want to make sure that we can stay in touch with you. We've got presence on social media. I know many of you already follow us on Facebook and Twitter. We're on Instagram too. And if you're not a social media person, that's probably smart. You can just go to our website, autismspeaks.org/advocacy. I would encourage all of you to do that if you don't mind. Scroll down to the bottom of that screen and you'll see a place where you can sign up for advocacy alerts. I promise we won't spam you, but we certainly will let you know when things are going on the state level, on the federal level, that affect you and your lives now during the pandemic and beyond. So with that, I will stop and see if we need any additional information. Kelly, do you have any questions?
Yes, we have a few, all our special education related questions. I'm going to combine the first and second. So Judith, have we, Autism Speaks, expressed the need for in-person solutions for our population of kids? It seems like the various school superintendents in Michigan need to get their unions to come along. And then related, how will it be decided when it is safe and feasible to receive in-person services?
Oh, that's a very good question. And that is one that, even in the general education space right now is being fought, between the different people who have a seat at the table, the governor, the unions, the legislature, the local schools. So yeah, the schools need to follow at a minimum the CDC guidelines. There are, as I said, protections in IDEA that allow for free and appropriate public education. And what we're seeing in Michigan or around the country is families are having to kind of advocate that on an IEP by IEP basis. I would encourage you, if you can, to reach out to our autism response team. And we're going to give you that contact information again, and we can share resources with you about what you can do to access those in-person services. And I acknowledge that too. I've dealt with that with my own son too, not having access to in-person, and it's really tough. So definitely something we're continuing to focus on, and our art can provide information around that too.
Thanks, Judith. And I would just add to that, we've got a really small staff team, so our efforts are primarily focused at the state level. We just don't have the ability to go school district by school district. So we hope that the information we're sharing will allow parents to feel confident in their own advocacy for the things that their student needs, and perhaps at the district level for the special education students in that district. The other question may be, another one for Art, but is there a mechanism, and I think they mean state specific, by which IEP families can pursue reimbursement if we have to go to a private education?
Yep. Well, so I know that for related services, and this is federal law, things like speech, OT, or PT, that might be a related service on your IEP. you can notify your IEP team 10 days in advance and pursue a related service with, an occupational therapist or physical therapist, someone like that. You do have to notify them 10 days in advance that you're going to be pursuing this if it's not being provided by your local school district. So that is federal law, that is clear. If you place your child in a private school and you're paying tuition and you're wanting reimbursement, that's a very complicated legal issue, even outside of the pandemic. It changes a little bit during the time of this crisis, but it is not a slam dunk. It's something, you'd have to really work with your IEP team on. So I would encourage everyone to be very careful about waiving any of their rights on their IEP. And sometimes we have seen school systems in a way trying to get families to sign away their rights during this time. You do not have to do that. You're entitled to a free and appropriate public education. So be super careful about what you're signing, and seek special education legal advice from an attorney who's qualified if you can, or an advocate who's qualified that can guide you, because it's, I acknowledge, very hard and important right now. The other thing I want to say, and it's good that we're on Zoom so you can't throw anything at me and because everyone's tired and overwhelmed and there's not enough hours in the day. But if it's possible, I would encourage you to participate, in your school district meetings, conversations around reopening as much as you can. As Kelly said, we've got a team that's fairly small. We do everything we can to advocate on the state level. We don't have the bandwidth to be involved in every school district. And that's what's amazing about advocacy. I mean, you can see this picture here is from a few years ago when we were working on insurance reform. There were families, there were physicians, there were legislators, people from all walks of life working on this issue, and they were working on it in their communities on the ground and also at the Capitol in Lansing. So same thing here during this terrible time. I hate to say this out loud, but no one cares necessarily. I mean, we have to bring situations to light and use positive advocacy to advocate what this very worthy population needs. So as much as you are able, be part of those conversations, represent the special education population. They're not being mentioned in the news articles, in the things that you find on the state education website. You really have to dig to find information about what's happening to kids on IEPs. So I would encourage you to be a voice on the ground as much as you can. And then please keep yelling at us too and telling us what's going on, and we'll do everything we can to advocate on the federal and state level to make meaningful change.
Judith, one last thing. One comment from Colleen Allen that the Autism Alliance of Michigan is working on some of what you're talking about, which is great.
Yes.
And then one last question, if you know, is a contingent learning plan one way to get parents to sign away their rights? They've been asked to sign a contingent learning plan.
Potentially. I would be very careful with that and definitely seek legal counsel as much as you can, because you're entitled to a free and appropriate public education, and having some sort of contingency exceptions could be problematic. So get some legal advice on that. And I want to give a big shout out to Colleen Allen. She's an amazing presence. Autism Alliance of Michigan has family navigators. They're on the ground providing great services to families. And they were a wonderful partner to us during our efforts to pass autism insurance legislation. So I'm so glad you're with us, Colleen. And I think that's all from a state advocacy perspective. Any other questions, Kelly?
No, that's it for now.
Okay, wonderful. All right, well, I'm going to move on. Colleen, are you with us? Shin?
I am. Hi, I'm sorry.
Yes.
Can you hear me?
Yes, we can. Yes, we can hear you. So everyone, you're in for a treat now. Colleen is going to talk about probably some information of which you're not aware that Autism Speaks has, resources that we have that are here to help you now. So Colleen, I'm going to turn it over to you, and then feel free when you're done just to close out the webinar. Thanks everyone for paying close attention and joining us today. Turn it over to you, Colleen. Thanks.
Thank you, Judith.
Sure.
Good afternoon, everyone. Thank you so much for joining us. I know we've given you a lot of information today. That's really important information, and I'm so proud to work closely with this team and provide this information. It's just so important. I will tell you that I have been directly involved in the autism community for over 30 years, and I have certainly never seen anything like this. I don't think I will ever see anything like this again in my life. And I completely understand from a provider perspective how hard this is on all of you, not just as parents, but also as providers and individuals with autism who are on the autism spectrum. We know that it's really, really hard. And there's a lot of different reasons why. I know Judith tells a story about her son who his part of that routine is going to Outback Steakhouse, and that might seem really trivial to us, but it's something that's so important for him because it's part of that routine. It's part of that sameness that he's used to. It's comforting to him, and it's also a social experience. And when you think about those kinds of situations being disrupted daily across the boards, it's really, really hard. It's taxing on people with autism, and then it becomes taxing on their loved ones because it's just such an unprecedented time. We also want you parents to know how much respect we have for you because you're taking on multiple roles and you're being teachers, you're being therapists, you're also, a lot of you probably trying to navigate your own work at home. And so this has just been very, very difficult. We've received a lot of information, phone calls, chats, live chats through our autism response team from adults on the spectrum, autistic adults who have either lost their jobs, lost their services, and in some cases haven't lost their jobs, but are shifting to working remotely, which has been a big change for all of us. And so please understand that when COVID hit in early March, our services and supports team, which is the mission area that I work under, shifted gears pretty quickly to create as many resources as we possibly could, but also to know that there's other fantastic organizations out there that we're collaborating with whom we've had relationships, who have wonderful resources as well. So we began to compile these into a very specific space on our website. And I've said this quote before because it's very true. You know, there's a famous quote that says, you know, everybody's in the same boat. And quite frankly, that's not true right now. Everybody's boat looks very different, but we're certainly all weathering this storm and we're weathering it together. Please know that we're here. We want to be here for you as much as we possibly can. So next slide, please. I know Judith talked a little bit before about the autism response team, and this is not a duplicate slide that's an accident. It's in here for a reason because we just cannot reiterate enough how important this team is. I've worked very closely with this team the entire 5 years that I've been here at Autism Speaks, and they're wonderful. They are a group of professionals who have degrees related to autism, who have a personal and or professional connection. They are taking phone calls, live chats. We have a dedicated email line for people. We have a Spanish speaking line so people can call that line directly. So the 800 number is 888-288-4762. That's actually 888-AUTISM2 spelled out numerically. And then to reach someone directly in Spanish, that number is 888-772-9050. We also realize that some people don't have time for a conversation. Having conversations is difficult for some people. So we do have that dedicated email line at help@autismspeaks.org. Again, just about 2 months ago, we instituted a new live chat feature that's on our website. So if you go to autismspeaks.org, you'll see at the very bottom of the landing page a little gold chat. Oops, I'm not sure what that was. I apologize if anyone else heard that. But you can chat with them live also. And this is a team of people who are available from 9 a.m. to 5 p.m. in all time zones. That live chat's available from 9 a.m. to 7 p.m. Eastern time as well. And the important thing to note about this is that it's not just for parents. You know, we have social workers, teachers, other professionals, caretakers, and autistic individuals themselves who are contacting us for very specific resources and individualized attention paid to their specific situation. So please, if you haven't heard about this, share this out with people because it is a very, I think, the best kept secret at Autism Speaks that we do not want kept a secret. Next slide, please. So if you go to autismspeaks.org, again, the main landing page, you'll see a gold banner at the very top, and that is specific to the COVID resources we've compiled. This is broken into several different sections. There's just a plethora of resources on here. We know right now that virtual learning and just virtual activities in general are very, very important. And so we have a really vast opportunity and a lot of different options to click on for that virtual learning and summer activities. These are really across the board, across the lifespan, available across the spectrum. There's just some fantastic opportunities for families. I've actually gone on and looked in some of these, and they're pretty fun. We also just have very specific COVID resources that are broken into different categories. So we have one for adults, one for professionals, one for healthcare professionals, one for families. It's a whole link just for families, and one for adults on the spectrum. It's also just very important to know how to handle, and I know we've talked a little bit about this on this webinar, what that clinical care looks like, what those social distancing and school closures look like, why those are happening, and how to handle those, because it's really very different for every single person. And just in general, what should the autism community know about during this coronavirus outbreak, and how this is just kind of a continuing fluid situation. So we're really adding to these resources daily as we learn more about this and we receive more information about it. A great way to keep in contact with us is through our local Facebook and Instagram pages. I know that there's an Autism Speaks Michigan closed Facebook group, and if you would like to join that, please do so. We usually will be posting the link to this webinar on there. We usually have some very good local information about things that are happening in your backyard or at a state level. So please check that out and join our social media platforms. The other thing is, a lot of people don't realize the plethora of resources that Autism Speaks has outside of COVID. So about 2 years ago, we revamped our website and we put different topics into categories so it was easier to navigate through these. So if you look here, you can see just some of the different topics that we have. So financial planning, I know that that's a really important topic on people's minds right now, as is safety. Safety is always a concern for this community, and we have a lot of different resources around safety that are really beneficial to families and individuals supporting people with autism and people with autism themselves. School, obviously. We have a new Iep Digital Toolkit that if you go into the school resources, you'll see the Iep Digital Toolkit. This is also a free downloadable toolkit, but the digital platform is really nice because you can navigate through that and put in your particular level of support and need. And then all of the information will be tailored to that specific level. Again, all of these different topics. The other one that's being translated into more digital platforms is our transition to adulthood information, and that's also become a digital roadmap that's customizable by level of need. So please take advantage of these. There's so much information on here, and it's so very, very helpful. We have 48 free downloadable toolkits, as I mentioned, some that are being translated into digital information that can also be navigated through on a cell phone. So please use that, the resources as well. And I just wanted to say thank you so much for joining. I'm blessed to work with this advocacy team. I think advocacy does very quiet work, but it's very important work. And it's so impressive to know that they're out there advocating for this community, not just federally, but very specifically statewide and state-specific information. You should be proud of them and as proud of them as I am for being out there and on your side, because they're just a wonderful group of people. And we're really fortunate to have them out there advocating on your behalf and your loved one's behalves. But thank you so much. I think we don't have any more questions, but this will be emailed to everybody who attended and registered. So thank you guys so much. Please stay safe and be well and have a great rest of your week.